Hi everyone. I'm Krishna, your Clinical Safety Officer at Innovate Health Consulting Limited. Welcome to this training session on clinical risk management specifically tailored for IT suppliers and healthcare technology teams. In today's session, we'll cover the essential clinical safety principles you'll need to know when developing or deploying digital health solutions safely and effectively. If you have any questions, please feel free to contact me at the email provided. I'll now hand over to your virtual trainer.
So, what is clinical safety standards? And why clinical risk management is extremely important while we are implementing a health IT product to the healthcare system. The clinical risk management helps identify and manage risks associated with digital health systems to protect patients from harm. Clinical risk management is mandatory under the Health and Social Care Act 2012 and Health and Care Act 2022, with two key standards to remember. DCB0129, which applies to manufacturers, and DCB0160 for deploying NHS organizations. For effective clinical safety, certain documentation is mandatory. Clinical Risk Management Plan outlines how risks are managed throughout the life cycle of the product, including roles, responsibilities, and processes. Hazard Log, a live document that tracks hazards from identification to resolution. Clinical Safety Case Report presents evidence demonstrating that your digital product is safe for clinical use. These documents aren't just formalities, they're vital tools in protecting patient safety and ensuring compliance with clinical safety standards under Health and Social Care Act 2012. Clinical harm refers to physical or psychological injury or damage to a patient's health due to healthcare intervention. This ranges from minor inconvenience such as delays in care to severe outcomes like permanent disability or death. For example, minor harm, a patient experiencing temporary discomfort or anxiety due to delayed appointment notifications. Major harm, incorrect medication administered causing a severe allergic reaction or hospitalization. Catastrophic harm, a system error leading to patient misidentification and incorrect treatment resulting in death. Identifying hazards is critical, and the structured what-if technique, SWIFT, is a proven method. This involves asking structured questions such as, what if the system loses patient data? How could incorrect patient identification occur? Is it possible for prescriptions to become corrupted? This technique ensures a systematic approach to spotting potential clinical hazards early. For instance, ask, what happens if a patient's birth weight is entered incorrectly? It could lead to improper medication dosages, putting the patient at risk. Once hazards are identified, managing them is critical. You must eliminate hazards by design. Implement technical solutions like mandatory fields and input validation, ensuring accuracy. Training. Develop user guides and training sessions to educate users on correct system usage. Business process changes. Clearly document and communicate the intended use of the system, adjusting processes where necessary. For instance, robust integration checks with NHS number verification prevent patient misidentification. Properly trained pharmacists reviewing digital prescriptions further reduce risks. Clinical incidents or near misses must be managed proactively. Report. Incidents can be reported by anyone, users, developers, support staff. Log. Document clearly what happened, potential causes and harm. Escalate and resolve. The clinical safety officer reviews, assesses risks, and ensures actions are taken promptly. Regularly updating the safety incident log ensures continuous improvement. Effective clinical risk management involves everyone. 1. Clinical Safety Officer, CSO. A qualified clinician responsible for overseeing the entire clinical risk management process. Developers and technical teams design, test, and implement safety measures. Top management. Ensure policies and resources support clinical safety practices. Users actively report incidents and suggest improvements. The Health and Social Care Act 2012 mandates two key standards. 1. DCB0129 applies specifically to manufacturers and IT suppliers like you. It mandates documenting clinical risks associated with digital health technology solutions throughout their development and life cycle. You must clearly demonstrate that solutions meet safety standards before they reach healthcare providers. DCB0160 applies to NHS deploying organizations, ensuring that digital technologies are safely integrated into clinical workflows. It mandates ongoing risk assessments, safety testing, and monitoring. Think of DCB0129 as the manufacturer's responsibility, the final inspection before a car leaves the factory, ensuring your vehicle is safe and well designed. DCB0160 as test driving and regular maintenance checks on the vehicle once it's in use. Effective clinical safety compliance requires specific documents. Clinical Risk Management Plan clearly outlines procedures for identifying, evaluating, and managing clinical risks. It includes roles, responsibilities, timelines, and methodologies adopted. Hazard Log, a dynamic document listing all identified hazards, their associated risks, mitigation actions, and ongoing monitoring throughout the product lifecycle. It acts as the single source of truth for clinical risk management. Clinical Safety Case Report. This summarizes how the system meets safety standards, documenting the evidence of completed risk assessments, implemented controls, and the residual risks. It must demonstrate that the digital health technology is safe and fit for its intended clinical use. Role of Clinical Safety Officer. A Clinical Safety Officer, CSO, is a mandatory role under DCB0129 and DCB0160. The CSO ensures compliance with clinical safety standards, coordinates CRM activities, and oversees the identification, assessment, and mitigation of clinical hazards. They also lead clinical incident management processes, ensuring that risks are managed transparently and proactively. Your roles and responsibilities as a health IT supplier. As health IT supplier staff, your responsibilities include identifying and reporting clinical hazards proactively. 2. Collaborating with your CSO at Innovate Health Consulting to document identified hazards, assessing risk levels, and actively contributing to solutions. 3. Ensuring adherence to clinical risk management policies, using the hazard log to track identified risks, mitigation actions, and outcomes clearly. Supporting continuous improvements in clinical safety by promptly reporting any incidents or near misses encountered in your work. Identifying clinical hazards with structured what-if technique. The SWIFT method is a straightforward way to identify clinical hazards. It encourages asking structured, proactive questions such as, what if patient records become corrupted? How could incorrect medication details appear on a patient's profile? Is it possible that notifications fail to alert clinicians timely? Using structured questioning helps systematically uncover risks that might not be immediately apparent, facilitating more robust risk management. Hazard management and risk control options. After identifying hazards, it's essential to manage them effectively using methods such as design solutions, technical controls. For example, mandatory fields and input validation can prevent incorrect patient data entry. User training and guidance to ensure everyone clearly understands how to use the product safely. Business process adjustments, clearly communicating intended uses, limitations, and workflows. For example, ensuring correct patient identification through robust validation checks, or creating user training guides that reduce the risk of user errors. Clinical incident management. Incident management involves structured actions. Report the incident clearly, via email, incident forms, or direct contact. Log the incident details and initial assessment into the incident log or hazard log. Escalate immediately to the CSO for prompt evaluation. Resolve incidents through appropriate corrective actions and communicate learning to stakeholders to prevent recurrence. Your role as ET supplier. As staff working for an IT supplier, your responsibilities are to understand the clinical context your solutions operate in and the impact on patient safety. 2. Follow clinical risk management processes rigorously. ensuring documentation, like hazard logs and safety case reports, are accurate and up to date. Maintain open communication channels with healthcare providers to effectively identify and manage risks collaboratively. 4. Continually raise awareness about clinical safety, report hazards proactively, and engage actively in mitigation processes led by the clinical safety officer. Clinical risk management is essential for ensuring the safety of digital health technology and protecting patients from harm. It's not merely about compliance, it's about proactively identifying and mitigating risks throughout the life cycle of digital solutions, making a genuine impact on patient care. In conclusion, effective clinical risk management is critical for protecting patient safety. As part of Health IT Supplier, each one of you has an essential role in embedding these principles into your daily work. Together, through proactive hazard identification, robust risk management practices, and clear incident reporting, we can significantly improve patient outcomes and ensure safer, more effective digital healthcare. As a Health IT supplier, your vigilance, awareness, and active participation in clinical risk management directly improve patient outcomes and ensure your digital solutions remain safe, reliable, and effective. Thank you for playing your vital part in safeguarding patients and supporting healthcare excellence. And thank you for your attention, commitment, and ongoing support in achieving the highest standards of clinical safety.